started to shake, he started to drool, and his parents were really concerned that he wasn't breathing right. So they called 911 and had an ambulance come to get him. As he arrived at a community emergency department, both the EMS staff and the hospital were concerned that he might be having seizures, and so they gave him lorazepam. That's a benzodiazepine medicine that's often used as a sedative and also used to treat seizures. They gave that to him at the scene. When they got to the hospital, they gave him 2 more doses, and then when he was still seeming to shake and maybe be seizing, he got 1 additional seizure medicine. And he remained critically ill in that emergency department, and they decided that they had to take big steps. And so they put a tube down into his airway in a procedure that we call intubation, and they put him on a mechanical ventilator, and we're working on the next steps. Well, it was interesting because at that time, the father said, I think I know what those white pills he vomited were. He recognized them. And he said that they're actually what he called a homeopathic medicine sent by a doctor with a homeopathic website. It was used to treat the dad's diabetes. And the medicine is actually mailed into his home from a doctor in Pakistan. And you can see in the upper right-hand corner of your slide is an actual picture of the bottle that these pills came from. And in the little bag down at the bottom of your slide, you can see what one of these intact pills looks like. So, wow, we have a real challenge here, right? We have a child who became acutely sick. He started to have seizures. He was intubated and put on a mechanical ventilator. And all we know is it's some foreign imported homeopathic drug. So I can't see you, but it's an interesting point to have everybody think about, do you know what's going on here? What could this be? I think that, the emergency doctor taking care of him at the time was a little bit confused, and there was a lot to think about. And so everybody said, you know what, this sounds like a case for the Poison Control Center, and we were called. A little more history came in at that point in time. The child's father actually had a brother living in Pakistan, so he called him, and he had his brother go over to the doctor's house who prescribes the medicine, knock on the door and wake him up. It was early in the morning there. And the doctor said, oh no, what I'm sending is methylcobalamin. That should be no problem. And methylcobalamin is one of those big chemical sounding names that most people wouldn't recognize. But what methylcobalamin is just vitamin B12. And so, yeah, that should be no problem. And so it's interesting. What does the Poison Center think of that? I think we thought, well, if this was really vitamin B12, there would be nothing bad happening. So either this isn't vitamin B12 or maybe the child got into something else. And we know that we have a lot of problems with natural medicines, and we have a lot of problems with imported natural medicines. Even in the United States, natural remedies are not regulated by the Food and Drug Administration. We often have problems with quality control and with contaminants. And when they're brought in from other countries, all bets are off. So as they investigated a little bit more, they said, well, could it be something else? So what medicines is the father on? So he's on a medicine for diabetes. He's on a couple of medicines for his cholesterol. His wife is on a medicine for blood pressure and another medicine for anxiety and depression. But we also learned that the landlord recently put mouse pellets, pesticides in the home. So, wow, that becomes a real challenge. What could be in the pesticides that are in the home, and could the child have gotten into that? And so most people are familiar that they can go to their hardware store and get some poisons to kill mice or rats or different pests. And most of those are anticoagulants, and some of them are like giving really mega doses of vitamin D. But at poison centers, we know, boy, we need to worry about things like arsenic or thallium and some of these other very strange types of medicines like norboromide or barium carbonate or red squill that you might not see. And we start thinking through all of those. And then most importantly, right, we look at the child, and what we know is this child has been vomiting, he's been shaking and having seizures. It turns out he has a very fast heart rate, over 200 a minute. His temperature is really elevated. When they get some initial labs, his serum potassium is really low. His body's building up acid. And the hospital, of course, does a urine drug screen. And when we watch CSI on TV, it seems like everything pops up on urine drug screens. But as toxicologists, we know that urine drug screens rarely give us the answer. And so we might think about things that cause seizures. And when we look at this list of things that cause seizures, right in the middle of this little chart, there's a big word, sympathomimetics. Those are things that mimic the sympathetic nervous system, and that's a big word for stimulants. And so we think about stimulants as a cause of seizures. We also mentioned that he had a low serum potassium, and when we think about that, we find on this list it says beta adrenergic drugs and caffeine, which are another word for stimulants. And so we think about stimulants. And so the Poison Center suggested to the doctor that this sounds like a stimulant, and the way it came, probably caffeine or something like theophylline were most likely, and we gave them some recommendations they could use to treat the child and to stabilize the child. And we then did specialized toxicology testing and found out that this indeed was a mega overdose of caffeine. It also showed some theophylline, which is a breakdown product of caffeine. And interestingly, another natural product called yohimbine. And poison centers, again, tracking the risk from these, we see that there are fatal caffeine overdoses from dietary supplements. We see children with acute caffeine poisoning from these supplements, and we find that they're especially dangerous when they're mixed with drugs like yohimbine. So that's kind of what we do. We look at these cases, we decipher them, we use our expert help, and we look at the medications, the overdose situations, whether they're special populations. We work on education. We work to respond to substance use disorder, and we try to do that in the most cost-effective way possible. And both of our poison centers, both in Philadelphia and Pittsburgh, are on Facebook and other social media. I put our Facebook sites down there. We'd love it if you followed along. We try to alert you to trends and to know what's kind of going on in the culture of the United States at the present time. And we'd love to have you following us and participating along with us. And now that I've told you a little bit about what poison control centers do and how we respond and the way that stimulants may present, I'd like to turn it over to Dr. Lynch to talk about the stimulant problem a little bit more. Michael?
Thank you, Kevin. Thanks for the overview, and I certainly echo what he says regarding our availability and value, and always happy to help. And I think it's also interesting and appropriate, Kevin's presentation of a stimulant toxicity that isn't what we necessarily think of, right? When we think of Psychostimulant Symposium and stimulant drugs, we think of cocaine and amphetamine and methamphetamine and so forth, and that's very true. But it also means a lot of other things. When we look at a patient, we often don't know what it is that they took. We just know how they look and what we're having to treat, and then work backwards from there. And what we find is there's a lot of different drugs and drug types that can give you that kind of presentation that look like a stimulant, that we treat very similarly, even if the way that patients get there are different. So I have here listed a few different categories, if you will, and we often think in drug classes and categories. Certainly cocaine remains among the most common, certainly illicit stimulants. Prescription amphetamines, I'll show you a bit later. We see increasing prescription amphetamines over time, and certainly there are medical disorders that respond well to amphetamine treatment, but there is also risk for diversion and misuse, as we've seen with other kind of controlled substances. Methamphetamine in Pennsylvania, certainly where we are, over the last few years, we've seen quite an increase, and I think that's been throughout Pennsylvania, in methamphetamine use, whereas historically, when I started my practice a little over 10 years ago, we almost never saw methamphetamine use, or at least not at much of a scale. And over the last couple of years, that's really changed. Cathinones or bath salts, I think, going back almost, not quite 10 years ago, those really came on the scene quite abruptly, and since then have had multiple variations. And what we often see with almost any kind of drug is you have a base drug like methamphetamine or cathinone or whatever, and over time people add to it and change it chemically, and it changes the presentations and the names of it, and trying to keep up with scheduling and enforcement or drug screens. things like that all come into play as they get chemically modified over time. And we've seen really an explosion in variation of drugs available to folks on the street. Synthetic hallucinogenic stimulants, things like N-bombs, which are often known as, quote, acid, because they'll come on blotter paper, much like LSD used to, or still does, though we don't see that much LSD. Dissociative agents, phencyclidine or PCP. In the western part of the state, we don't see a lot of phencyclidine. I think more in eastern PA and certainly in Delaware, where the Philadelphia Poison Center and in DC and the East Coast, PCP has been a more common agent. Methoxetamine and other sort of designer dissociative agents. When I say dissociative, it means they sort of people describe out-of-body experiences, which can lead to all sorts of different activity. It's often thought of as a really strong stimulant, but what we usually see with these things, it can be stimulating, and patients often don't feel pain, which can lead to really bizarre behavior, but oftentimes people are almost more catatonic. But when they're stimulated or startled, they can become very aggressive very quickly. So kind of another way of presenting with a stimulant, and certainly one that we historically know about a lot. Serotonergic hallucinogens, so LSD, DMT, so people using things like ayahuasca and other kinds of plants and nutmeg and things like that they can order online, lead usually not to quite so much agitation, or even ecstasy. MDMA is more serotonergic than anything else. Synthetic cannabinoids, obviously that's in the cannabinoid class, but different from marijuana, which can lead to some paranoia and some hyperactivity. Synthetic cannabinoids can really lead to a severe agitation. We saw in Allentown, Pennsylvania a few years ago, as well as throughout Pennsylvania, and more where we hear about quote-unquote K2 or spice. Patients where originally we thought it must have been some type of methamphetamine or synthetic cathinone, because patients were so agitated that they had to have breathing tubes placed, put on ventilators, or died as a result of that hyperactivity. But it turns out that that's what happens when you get too much activation of cannabinoid receptors, because these are pure agonists or pure activators of those receptors, as opposed to marijuana, which are sort of like partial activators of those receptors. And then obviously Kevin gave you a good example of what can happen with a lot of caffeine or caffeine overdose. And we see this, as people will sell sort of powdered caffeine online to make your own energy drinks and things like that. Can really lead to significant toxicity. I don't want to get too sort of clinical or too much into the chemistry of it. But when we think about, the way that I like to, and a lot of toxicologists like to think about what we see in a person is at the chemistry level. What is going on? What combination of factors, neurotransmitters, and receptors are leading to these kinds of effects? And so I kind of have a list here and some pictures on the right of what some of these drugs look like. But big ones in particular are norepinephrine and dopamine, where we see the increased heart rates, increased blood pressure, agitation, seizures, hallucinations. And there's a lot of overlap with these various receptor complexes. And so that's what we see when a patient comes in, is they can be super agitated, delirious, meaning they don't know where they are or what's going on, aren't able to interact with you. Heart rate and blood pressure effects can lead to heart attacks or bleeding in the brain. They can have trauma. They can have muscle injury and breakdown because they're so active, particularly if they have to be physically restrained for a while. We know that can be dangerous because their body is just chewing through energy, forming acid, and sometimes, especially if you're pushing on them, they can't breathe as well, so acid builds up in their system, and that can lead to some of the fatal effects that unfortunately we sometimes see. And it can be really difficult to manage and really dangerous, not just for the patient, but those who are caring for them in that kind of situation, because they don't know, they aren't themselves and aren't able to regulate themselves, either physiologically or physically. So, what do we do to treat folks when they come in? What we really want to do is just calm everything down. So a lot of times, some degree of physical restraint is initially necessary just to be able to care for them. But the main goal with these stimulants is just to sedate them, to chill them out. Primarily what we use are things like benzodiazepines, so that can be brand names are things like Ativan and Versed, which a lot of paramedics will carry. There are others as well, but those are two of the real common ones for acute agitation. Antipsychotics, things like Haldol and droperidol, which are, or Zyprexa, though we use a bit less of that, are some of the antipsychotic brand names that you'll see. Something we've seen more of in appropriate situations is high doses of ketamine. Now, ketamine is listed as an anesthetic. It can actually be misused and can act similarly to things like PCP, but in really high doses can cause sort of that catatonic, sort of sedated state without generally lowering the breathing rate. Now, it can be dangerous, and it shouldn't be given to folks who aren't really agitated, and shouldn't just be used to sort of control behavior that isn't sort of stimulant related. But it is a really helpful adjunct both in the pre-hospital and the hospital setting for patients who are supremely agitated, who are a risk to their own safety and the safety of those around them because of their agitation. We can give, and it can be a shot in the muscle, which is also helpful if we're not able to get an IV. And then medications, true anesthetics like propofol and things like that, though that will require putting a breathing tube in to just get people to calm down so that we can hydrate them, reduce the acid in their blood and so forth, let them breathe, even if we have to do it through a ventilator. And then sometimes that's necessary, and that's not necessarily a failure. Oftentimes what we do in toxicology, particularly with things like this, is take care of the patient while their liver and kidneys get rid of the drug. So we often aren't getting rid of drugs, we're just keeping the patient safe until the drug can go away, and that's the case here. We don't have an antidote like naloxone for stimulants. That's a question I sometimes will get. None of those drugs that I've just talked about or managements are antidotes. They are just ways of, again, keeping the patient safe. And then patients need fluids to sort of hydrate and get rid of some of the breakdown products from their muscles and reduce the acid in their system. And sometimes if they're overheated, they can actually have a fever, which is one of the primary sort of predictors of bad outcomes. So if they're really hyperthermic or have a really high temperature, we'll cool them in addition to sedating them and hydrating them. So, I don't want to get too, I'm sure you guys are getting a lot of information and presentations on some of the epidemiology. I just think some of the interesting factors that we see, I'll present quickly, and then I want to leave plenty of time for question and answer and discussion. So I think, interestingly, we have certainly seen over the last few years, we're all very well aware of the opioid epidemic that is ongoing and exacerbated and worsened by the pandemic, with more and more data demonstrating that. But we've also seen an increase in substance use risk and stimulant use in general, particularly in Pennsylvania over the last few years. I think some interesting data from the NSDUH is that new stimulant use, misuse, I should say, surpasses opioid misuse, and that's been a trend for the last couple of years. It's similar, but when we talk about new starts, of misuse, it's a trend that we're seeing. Pennsylvania, these are cases reported to poison centers. The 2020 data is sort of extrapolated based on our data to date. If we were to look through the end of the year, and that's through the end of October. So we've seen a pretty steady, we've seen a bit of a decline. I will say that can come from a combination of factors. One, we're dependent on what is reported to us as a substance. So if it's not one of these topics, these substances, we wouldn't know it. And two, as people get comfortable, especially healthcare providers, managing different substances and chemical exposures, they become a bit less likely to call us. So you see that with synthetic cannabinoids in particular. I know for a fact that from working in the emergency department, use has continued, if not grown, but we get called less because, we've gotten more, it's become part of our regular practice. Methamphetamine numbers have continued to rise as we've seen prescription amphetamines have stayed at a high level, whereas our cocaine calls have actually gone down a bit. And this is a map, not surprisingly, in Pennsylvania, Allegheny County, where I am, Philadelphia County, where Kevin is, are the two hottest spots. And the darker the blue, the more commonly used. But you can see kind of a lot of the rural areas of the state outside of the main cities have had problems with these stimulant uses, at least as reported to poison centers. This was, I thought, interesting data from the state regarding prescription stimulants. Compared to 2016, we've seen an increase in overall prescribing. So again, availability in the community of stimulants. And this is, I know, a little bit hard to look at. So I'll just show you that this, I don't know if you can see my cursor, but third from the bottom, this sort of brown, and I'm colorblind, so if I'm wrong on the color, I apologize. This sort of brown color is methamphetamine, and these are drug seizures through 2019 in Pennsylvania, and we can see methamphetamine has grown significantly. Not surprisingly, the purple below it is fentanyl. We've known that that's been increasing as well. Whereas cocaine was increased in, about 10 years ago and has remained more or less stable as far as seizures over the last few years. And heroin has gone down as fentanyl has gone up. None of those things are surprising. But as it relates to psychostimulants, I think the methamphetamine growth in Pennsylvania is consistent with what I'm seeing clinically and a significant trend. As far as hospitalizations, PHC4 data, cocaine hospitalizations have been relatively stable the last couple of years, whereas methamphetamine hospitalizations have increased almost 2/3 compared to 2017. So certainly amphetamines and specifically methamphetamine has been a significant increase. And then finally, just overdose deaths. We've seen an increase, unfortunately, again related most likely to the pandemic. This is preliminary data. We know that death data always lags behind. This was updated, in November of this year from the CDC. So we see this rise at the early part of this year as we get into March and April, and we are seeing that 41% of our opioid deaths also involved a stimulant. We can say that most deaths with stimulants are probably the death is related to the opioid, but we do see stimulant-only related deaths. In the Northeast, this study was showing, we can see that the Northeast here is on the left. The two bottom bars are opioids. The lighter bar of those two is opioids plus stimulants. And then the even lighter, kind of second from the top, is stimulants only. So in the Northeast, that remains a pretty small percentage of our overall deaths, but you can see that grows as you get further south and further west. And that's been historically the trend, where the West Coast sees much more stimulant-related pathology and death. But unfortunately, we do see a growing trend in that here in Pennsylvania. So I know that was quick, but I also wanted to make sure we left plenty of time for discussion, which I think was the goal of this workshop. So I'm happy to answer any questions, as I'm sure Kevin is, and thank you very much for your time and attention.
Okay, this is Gail, and I do have some questions that I have been monitoring on our screen. Okay, so let me just pull those up. All right. Let me see here. Where are they? Oh, I'm sorry.
Michael, you want to take the adult question for me, or?
So the
Sure.
first question is it possible
the short
for
answer
a
is yes,
teen or
absolutely.
adult
to
overdose on
it's hard
caffeine?
to overdose on
How much
caffeine and sort of
caffeine
like
is
standard
necessary
drinks
to
and
cause
things
an
like that,
overdose
though we
in
did
a
see
child or
historically some of
older
the strong
individual?
energy alcohol drinks like Four Locos, and we would run into problems with the combination of alcohol and really kind of potent caffeine. If you think about caffeine pills, things like brand name No-Dose, for instance, those are usually about 200 milligrams of caffeine, which is far more. It's like multiple cups of strong coffee, essentially. And so if you start getting into multiple pills, one pill can cause some side effects, but as you get into multiple pills of something like that is when you start to, it's a continuum of progression of tremor, high heart rate, eventually potassium going low, and then risk of seizures. And how much it takes would vary by individual and their susceptibility. But the really dangerous, in my mind, potential for overdose in an adult, and these are going to be intentional, either to hurt yourself or not understanding the chemistry or attempt to get some stimulant sort of high, are the powders. You can order like just powdered caffeine, which it wouldn't take a lot of. We're talking about milligram doses and gram doses. If you took it directly, whether snorted or mixed in really high concentration on your own, to get to a toxic level and lead to all those same toxicities. I don't see it a lot, fortunately, but cases have certainly been reported, and that's something that we're very careful of. And I think pediatrics is an even greater danger. So for that, I'll defer to our pediatric specialist.
And even that, it's interesting, Michael, because, I think the question probably talking about overdose was to get really sick, like the patient I presented. But in general, I'm not a coffee drinker. Every once in a while, I'll have an iced coffee or something like that. And just the other day on my way to work, I said, oh, I'm going to try a cold brew. And I drank it, and I couldn't concentrate for like the next 6 hours. So kind of depends on the overdose effects that you're looking for. But certainly, I'd agree with everything that you said. Mm-hmm. Yeah, thank you for that question. I'm sorry I didn't make that clear when I went through. So we actually did analyze those homeopathic diabetes medicines that were being sent in from Pakistan, and they were almost a pure mix of caffeine and neohymbine. So it was from those pills that were mailed in from Pakistan. They just didn't happen to be what the doctor who was prescribing them in Pakistan thought they were. They weren't what the person who was taking them thought they were, which is something that we see not uncommonly.
I'll defer. A lot of it is in pediatrics and adolescent medicine.
Thank you.
Yeah, I think the primary prescription is for attention deficit or hyperactivity disorder.
What are stimulant prescriptions used
related
for? And what are the medical problems
efforts? It's not common that they are prescribed for weight loss, but that's overwhelmingly the reason that people will take them. I can tell you another interesting story with another natural product. I know somebody who was the manager of a large number of employees, and those employees kind of got together and decided that they all wanted to lose weight together, and that they had found that bee pollen was reported to be something that would be very useful to them, and thinking about it, what could be more natural and healthy than bee pollen, right? And so they were all buying and taking bee pollen, and they were actually, some of them were pretty effective at losing weight. But the manager came to me and said, they're all so cranky and irritable all the time. And Kevin, do you know anything about bee pollen? So I actually got one of the bee pollen pills and analyzed it, and it was 100% caffeine. So the person that was selling them was just kind of using it as this other aid. And so that's where we see the stimulants used a lot. I think we're having a problem in high school and college students where stimulants get called smart drugs, and people will use them to try to do extra cramming of their studying and to learn more, and oftentimes taken repetitively in big doses in that setting. And then, of course, stimulants are drugs of abuse.
and as Kevin said, phentermine is a common one that we do occasionally see prescribed for weight loss. Adipex is the brand name for that, and then in older adults, sometimes for like folks with MS and things like that who need help with energy and so forth. Not just amphetamines, there are other kind of medications that are related types of stimulants that can be prescribed. So there's again, getting back to one of my points, the term stimulant can mean a lot of different things. So those are some of the instances where we see them prescribed.
Okay, thank you. Next question. Is nicotine toxicity typically treated in a similar manner to other stimulant toxicity? And then there's a second part to the question. Is the increase in stimulant use occurring potentially correlated to more naturally occurring
it is largely, right? When we talk about stimulants, we talk about things that kind of activate our nervous system.
So the first part is
kind of traditionally they have been things that work in the same manner that adrenaline does, and that's the way that methamphetamine works, and that's the way that cocaine works. Dr. Lynch showed a large number of other chemicals that work at other different receptors in the body. And we do have receptors for nicotine that stimulate our nerves in different ways. They can stimulate our muscular activity. They can stimulate our brain activity, often in a bad way. And big nicotine overdoses can be really severe. But similar to amphetamines, we don't have a good antidote like naloxone that we can just give and reverse that. There are kind of advanced things that we can think about sometimes, but in general, it's trying to settle everything down, sedate it, make sure that hydration and all of the other things that are important to the body are well taken care of until that nicotine effect is gone.
Yeah, I totally agree. It's interesting, it does have stimulant properties, but it acts in much the same way. If you think of like nerve agents and things like that act, it can do a lot of the same things where we see heart rates go up and then eventually down, and it has a very complex activity. And yeah, some of the treatment would be very similar, and others would be different. But yes, severe nicotine toxicity is very dangerous and very can certainly be fatal. And similar to the caffeine, it's also available now in more concentrated sort of formulations, like liquids that we use for vape refills and things like that can come as a concentrated nicotine product, which is fortunately not something we see a lot of exposure to, but we have seen it. It's been reported. It's been related to fatalities. Oh, I'm sorry. Gail, I'm sorry. I just realized I don't know that we addressed the second part of the question. As far as no, that's okay. The natural agents and things. It's interesting. Certainly that is part of it, but I at least from the Poison Center and Toxicology clinical practice,
Okay, thank you.
Plant itself kind
next
of product.
Question.
I don't
Have
see
calls
a lot
to
of
poison
toxicity
control.
from those other than sort of side effects and adverse effects. The more kind of significant and requires hospitalization are often based on derivatives of those. So things that start as plant-based products, but then are purified, intensified with chemical kind of side chain substitutions and things. This gets back to cathinone, for instance, which is from a plant, Catha ajulis, which they use sort of as part of a society in Eastern Africa and the Middle East. They chew it kind of like coca leaves in South America for mild stimulant effect, but then it's been taken and add methyl groups and different side chains, and now we have bath salts, which are based on it that cause much more severe toxicity. Things like betel nut, which is a recholine. We see people, if we get called about, it's usually for nausea, vomiting, shakiness, side effects like that, very much like nicotine. But again, it's usually the extraction, the purification, and then the intensification through chemical modification that leads to the really severe toxicity. But I think people are finding these plants with active substances and doing the chemistry more than had been done in the past, where the plant-based product itself was what was primarily being used, leading to side effects, but not quite as severe or intense of a toxicity.
Yeah, I think we see that phenomenon with almost every drug we could talk about, right? With marijuana, if you have any of those images of like Woodstock and Janis Joplin from the 1960s, right? And when they were smoking marijuana, it was 1% THC. Now the botanists have gotten really good. And so, the plant-based is 7 to 10% THC. But then we see people put 40, 100 milligrams of THC into a single gummy worm candy, right? And when an unsuspecting novice eats one of those, or a 2-year-old gets into them, the effects are really, really severe. And so it's when we kind of take these things and we get fancy with them and we purify them and we put them in concentrated forms that we really see our problems.
Okay, thank you. The next question, have calls to poison control about nicotine/vaping e-liquid overdoses been prevalent?
That's okay. Those are all terrific questions.
And I think have
that we do get a fair number of calls all the time about nicotine.
And then another part of the question,
for decades,
since COVID-19,
and one of the things
that
more or less Mr.
calls
Yuck
about nicotine
was famous for, right,
overdose from vaping products?
Telling kids in the home about things that were dangerous to them. And so all of our poison centers have protocols for what do you do when a child goes over to an ashtray and eats 6 cigarette butts. You wouldn't think they'd do that, but they do that, right? But things really intensified when we started to go to e-cigarettes and we started to have vape fluids in the home. And I would have brought some to show if I had, but they come in flavors like cotton candy and watermelon and things like that are really delicious to young children. They often have cartoon characters. And so children who find those bottles and drink them can get really, really sick. And we've taken care of children who've been in our intensive care unit with seizures that we couldn't stop after swallowing those vape liquids there. Michael's got a couple to show.
Got terrible lighting in here, so you can't really see
a little better light. But I think, when teenagers are using e-cigarettes and vaping, I think a lot of parents were aghast by that. I think that poison centers didn't get quite so many calls about typical use. That was more something that went to family doctors and pediatricians and teachers and things. Yeah. But last year, we ran into an epidemic of teenagers and young adults who were getting horrible, horrible lung disease and were put on ventilators and intensive care units and came with the various names, vapey and EVALI, e-cigarette and vaping associated lung injury. And those patients were getting really, really sick. And so poison centers took an integral part in watching the epidemic surveillance of those events, of assisting physicians in figuring out how to take care of those children. And so as epidemics like that occur, we get very, very involved. And then as Michael mentioned, initially we provide the answers. And then after a doctor has taken care of his 10th patient with e-cigarette associated lung injury, then they say, all right, I have talked to the poison center 10 times. I know how to take care of this. And the calls go down a little bit at that point in time. Oh, and then I guess the last question is, have those calls increased during COVID? And, we've been tracking a lot of different trends during the pandemic and knowing that we've changed where people are. People are spending a lot more time in the home during their social isolation, doing their work from home. We've certainly seen increases in calls of household products, hand sanitizers, things of that nature. I can't say that I've particularly looked at nicotine exposures to let you know. However, I do know that this lung injury from e-cigarettes had kind of gone away. And just in the past month, I've been having more cases of it appear again. And so I think that this epidemic is beginning to come back, and we're beginning to see things. And Michael, I don't know if you have any other comments there.
Nope, I completely agree with everything you just said. So I don't think I have much to add. I'll save the time for questions.
Okay,
Yeah,
so we have, this will probably be the last question.
The plant name for
we are running out of time.
The sort of
Do
the
you
Latin
notice an
genus and
increase
species
in
name, where
cat
cathinone
use in the
is
West
purified
Coast?
from?
That's in
And
quotations.
then, what we saw there was
Assuming we may be talking about
methylmethaquinone and
the
methylene
Western Pennsylvania, I'm not sure,
or
but it's called
MDPV. Those are some of the
KHAT.
original bath salts. COT, or CAT, like sometimes colloquially known as CAT, use specifically, maybe 10 years ago, grew up a lot in areas where expatriates or folks had immigrated from countries where its use was typical. So we would see it sort of in the upper Midwest and then in the East Coast and things more than that. But then, as those derived cathinones, aka bath salts, have become more prevalent, we certainly saw a surge in use early in this decade. I think throughout the state, Eastern and Western. Cathinones, it seems, have been a bit more of a Midwestern and Eastern kind of phenomenon, as opposed to classic methamphetamine stimulants, which has really been by far the most common in the west coast of the U.S. Unfortunately, one of the famous cases of bath salt or cathinone-related toxicity occurred, I think, like 7 years ago or something. A guy in Florida sort of like attacked somebody and tried to eat them, to eat the guy's face while he was high on one of these things. So certainly that was a really gruesome and exaggerated case. But we still see that. I don't think I see it quite as much, or at least it's blended into the rest of the milieu of increasing methamphetamine, other designer synthetics that people order online and have delivered to their house that may be chemically related to cathinone or some other chemical with a similar activity. But we definitely have seen it and continue to. But that was more of, I think, a North, Midwest, and Eastern kind of phenomenon, as opposed to methamphetamine, which was primarily in the West Coast.
Nope, I agree with Michael's thoughts.
Okay. Kevin, did you have anything to add to that one?
I saw that question, and I was asked what are stimulants prescribed for,
well,
and I had mentioned theophylline in my case, but I didn't say theophylline. And theophylline is a medicine that's prescribed for asthma. It's a medicine that's prescribed for adult patients with chronic obstructive pulmonary disease, or COPD.
For asthma.
I think that 20 years ago, we used to use it for asthma for almost every patient that was significantly ill, and especially significantly ill enough to come into the hospital. I think because of some of the side effects with the medication and with the kind of development of other medications, it's not used nearly as often. I would say use has dropped 98% for pediatric asthma especially, but there are still times when it is used, and it's still a prescription medicine that's available. And used appropriately, it's okay, right? It's when you get into the overdose situation or have other problems.
Just an interesting aside, a related chemical called theobromine is what's in chocolate that's dangerous for animals, but safe for humans.
Mm-hmm. Everybody loves the dogs.
Okay. Right. Mhm.
Right.
So, okay,
Mhm.
so now there's one more. Oh, that is interesting. Okay. All right. So, one more. Why is it?
Yeah,
I know we
it's,
do.
I'm not sure that's
I,
I have
And this time of year
I
is
don't know the
really
perfect
tough
answer to that
because there's
question.
a lot
I
of
can
more
tell you that,
goodies hanging
I
around the
work with a
house.
lot of
Uh,
young
okay,
people
so
who
why
have
is it
various
that
mental health
the
challenges,
people
whether
that
it's
suffer from
anxiety or
schizophrenia
depression,
are
in some
attracted to
cases schizophrenia,
stimulants?
and they often have responsibilities like the rest, like everybody does, where they want to concentrate on a task. And I think that they all describe having difficulty concentrating. The anxiety provoking thoughts become prevalent in your mind. It's hard to get them out. And we've all experienced that to some extent, right? Like, oh no, I can't believe this. And you start to think about it. And so when you sit down to try to do a task, you feel like you have a brain fog, or you can't
Mhm.
concentrate, or you can't think about it. And I think in short term, most people know that like, I can't do my job today until I have my first cup of Starbucks coffee or Wawa coffee on the East, or I don't know, do you go to Sheets in the West? I don't know. But um, so I think we all use stimulants in that way. And I think people that feel like their brain is clouded all the time are probably more likely to want to try to do something to clear it more often. That would be my best answer, but I don't have a good one. And I could certainly inquire with some of my friends that do more active psychiatry to see if they have an answer to that, if you're interested.
I don't think so. Just another sort of shameless plug that poison
Okay,
centers I think
thanks a
are
lot.
a bit more
That is
maybe
the end
than
of the
we have
questions.
historically realized
And
as far as what we're
if
able to
do
do and
you,
the
either
services
of
we're
you
able to
have anything
provide.
else you'd
So
like to
I guess I'll just
add before we
put in a
wrap up?
plug that if you have questions about any kinds of drugs, drug exposure, etc., don't hesitate to call us 24/7. There's specialists who are always available. So the 800-222-1222 number works anywhere in the country. So even if you move from PA and you go anywhere else in the U.S. and have questions, we can help or at least try to help. So please don't ever hesitate to call.
Yep, I agree. And we're both very grateful that we had this opportunity to talk to you. And we look forward to working with all the wonderful people around the state that are interested in these issues and are trying to help people. And so everybody stay safe and have a happy holidays.
Yep.
All right, bye bye.
Take care, everyone.
Yeah.